As the U.S. faces record daily coronavirus deaths, the CDC predicts over 80,000 more people could die from the virus by the end of January. That's in addition to the more than 342,000 deaths so far. Hospitals across the country are already being stretched thin, with some facing the possibility of having to ration care. To talk more about this, I'm joined by Dr. Amesh Adalja. Thank you so much for joining us. We really appreciate it. He's an infectious disease expert and a senior scholar at the Johns Hopkins Center for Health Security. So, Doctor, I want to ask you right away, given this updated prediction from the CDC, which seems like a huge number, what can hospitals do to prepare for this type of influx, if anything?
It's very hard for hospitals to expand their capacity. It's sort of almost like a fixed type of limit that they reach. But what hospitals can do on a day-to-day basis is make sure they have enough personal protective equipment. They can make sure that they have enough staffing. They can try and look at their hospital and see where they can create beds using places that maybe aren't usually places where people get care. They can turn those into ICUs or regular floor beds. And the other thing they can really do is accelerate their vaccination process as fast as possible, so more healthcare workers are protected, so less healthcare workers will get infected. And that's basically what they can do. And it's kind of a very limited number of options that they have at this point.
You know, I live in Los Angeles County, and I know at the beginning of the pandemic, as you're talking about, they did do these makeshift sites where people could be treated. And then, we didn't get the influx early in the pandemic like places like New York did. And a lot of those were shut down. Are we going to see those pop back up?
They are already starting to pop up in parts of California, and you're also seeing hospitals, for example, turn their recovery room into an ICU or using other areas of the hospital that aren't used to take care of patients. I think that what happened in the spring was that a lot of people extrapolated from New York City, and because they didn't get that New York City surge, it kind of got people to get a false sense of security that this wasn't going to happen to them. And that's why hospital preparedness all around the country kind of faltered, because people didn't think they were going to be New York. And this virus really has the transmission characteristics that allow it to do a lot of damage wherever you are. And hospital preparedness is something that's never really valued or never really prioritized by hospital administrators. And now we're really paying the consequences for it.
Yeah, we'll have to look at that going forward. Well, Americans were promised that 20 million people would be vaccinated by today, but just under 2.8 million is the current number have been vaccinated. What is going on with the slow pace of the rollout?
Vaccination distribution programs are difficult, and I think there was a lot of emphasis and a lot of credit is due to Operation Warp Speed for getting these vaccines developed and getting them distributed. But it takes a lot more to get that last mile, turning a vaccine into a vaccination. And that's where state and local health departments are the major drivers of that. And they're also under-resourced. They're not necessarily given the appropriate guidance or the support necessary to turn these vaccines into vaccinations. And I think we really can't think that this is over. We can't have a victory lap over Operation Warp Speed until we vaccinate enough people that we start to see some benefits in terms of case counts, in terms of hospital capacity. And I think that's really what needs to happen now, is that states need to be supported so that we can roll out this vaccine at a much faster pace. We're lagging behind many countries in their vaccination. If you look, for example, at Israel, much more per capita have been vaccinated there than in the United States. And I think we can't kind of dawdle along with this vaccination program, because we will continue to see hospitals in crisis until enough people are vaccinated.
Well, I have to ask you, based on what we're talking about, at this rate, how long will it take until we have herd immunity, and when can the average American expect to get a vaccine?
I still think that the average American will get access to the vaccine in the summer, maybe late spring, and we will probably start to reach herd immunity around summer, early fall with the rate we're going. We'll start to see benefits, though, from the vaccine when our vulnerable populations are vaccinated, because that's what's causing hospitals to go into crisis. So if we can get our nursing home population vaccinated, if we can get the vulnerable adults that live in the community vaccinated, we will start to see benefits. But it's going to take some time. I think we'll probably be still in crisis in hospitals as we move closer to the spring. Hopefully by then, though, we'll start to see the vulnerable populations vaccinated and our hospitalization rate fall. But it is going to be one of the biggest public health challenges, and we need to have this taken very seriously by the federal government, and they cannot abdicate their responsibility here the way they did with testing.
Before I let you go, Doctor, it's New Year's Eve. We've heard from a lot of cities who are closing bars and restaurants early. What's your advice to people to stay safe this holiday?
You have to remember that this virus is out there. There is so much community spread that any kind of social activity you do is likely to bring you into contact with this virus. So you have to be very careful. You have to follow those common sense precautions of wearing a face covering, washing your hands a lot, trying to avoid crowded and congregated places, limiting your contacts outside of your household. Try to do things outdoors if you can. If you can't, try to open a window. There are ways to try and decrease the harm that this virus is causing. And we know people are going to take risks. We know they're not going to all stay home and follow every guidance perfectly. So we've got to try and borrow from the harm reduction world that we use in opioid use disorder, that we use in sexually transmitted infections, and give people the tools to make better risk calculations, because we will likely see increases in cases from this. Hopefully it will be to a minimum, and it won't put hospitals into more of a crisis than they already are in, but it's going to be tough for the next several weeks.
Dr. Amesh Adalja, thank you so much. We appreciate it.
Thank you.